Pacho, and then you made no about our health. Na say you idea we are hospital bit me alcohol pa. I could share a video match say, then him pa no. Grace Medical Center near Zenith University. We are 24 hours. Bibi obeko bia sa okoko hye woni paduam bia no omobeye dia ma. Ena hena nkasa ye credit union. Omoso ka sponsors na omoboa enda dwumedie na ye di no na watwe dwumedie edi ni na no omo ka ho bi. Bebre o ho mo no minti. Ye de omo as times goes on ye de omo din beto ho. Yes, I'm brain ye de be frey your sister. Na ayokoma na be train ni pe na odi talking about my head and there.
Asa fombi nya fanya jola hani. Yeah. Yo wonder nan mo shiake ha wogbeke ne womba oba kaseni. Oba wa kidneys and kidney health and kidney safety here. Ni woba fe le ton woni wo fiole every year it will be a panel discussion. It woba na moderator ke wo resource person ke ka agbene wonyemi nu e ko mehuni survivor kidney renal failure survivor neke wo ba awie e wo nya find wo moderator for the session actually Adolf Olenu ni he's a project manager with over 10 years experience in the Ghanaian public health and global health systems. He currently works with as a program director for Orbis International, an international NGO that works to prevent and treat avoidable and curable blindness in the world. When you find how they try when you mean Adolf Olenu. He's a member of Nativity, he's a member of YAF. And then we move on to our facilitator, our resource person, who is Dr. Mensah Amoah, a physician specialist and fellow in nephrology, Kolebu Teaching Hospital. And then we have one of our very own who has survived kidney disease and is here to tell us his story and how he went about it, and he's still alive. We give God all the glory. He's a member of YAF. He used to fellowship here, but he's moved to Ashie, so he's now at Victory. If I work at the track, when you mean Vincent Debuto. So I hand over the session to Adolf to take over. You find your radon.
YAF. So I think it's a great honor for me to be in this position to moderate or talk now. And it is equally exciting. We don't just have a specialist, but we have a survivor. Well, we can choose to say we have a patient, but I want to describe him as a survivor because he has been able to go through it. And it's our expectation by the end of this session, we will learn a lot from our resource person and then the survivor. And if we have questions, there will be a time that any questions that you have, you can ask and then you would have answers. So when that time comes, I will urge everyone to not hold back and then ask your questions. So at this point, without wasting much time, let's get the show going. Doc, thank you very much for joining us.
You're welcome.
Brother Vincent, thank you very much for your time. So I'm going to ask some questions. Some might be applicable to both of you, and then some too will be directed to each of you at different stages. So, Doc, we would want to know what is the kidney, which part of our body it's in, and then its particular function.
So the kidney are two organs which is located at the back of the abdomen. So if you take your abdomen, the back here, there are two of them. It's usually shaped like beans. And at the back here, God placed them there in such a way that if you have some trauma, it's somehow protected. It tells you how important it was. That's why God made it the way it is. And its main function is to remove waste products in the body. The body undergo a lot of activities. We eat, we drink. As we go about our daily activity, there are certain things that after the body has done its work is supposed to be removed out of the body through the urine. So the kidney that produces urine, and that urine removes waste products out of the body. By so doing, it's able to maintain the blood very well to make sure that everything in the blood, with certain things we call electrolytes, sodium, potassium, all these things are maintained in a normal way. The kidney also helps the body to produce blood. So when your kidneys are not working well, you realize that you are tired, it means your blood levels are low. One other thing the kidney does is to maintain our bones health. It plays a very key role. So the kidney does a lot of things in the body. This is just a summary of some of them.
Okay, thank you. So, I think to emphasize, the kidney is not just for removal of waste,
exactly,
but it also plays a very important function in production of blood and then also maintaining bone health.
Yeah.
So, Doc, what are types of kidney diseases that we have, and what are the causes of each of the types?
Okay. So we have two main types of kidney disease. And when I say kidneys, I mean kidney failure, when the kidneys are not working well. We have what we call the acute, and then we have the chronic. But today I'll focus more on the chronic because that is what is giving us a lot of problems currently. So the acute is someone who has a normal kidney function and has a sudden onset of kidney failure, meaning that something happened to them, they fell sick. Maybe they had severe malaria or severe diarrhea or some infection. Or a woman goes to deliver and suffers severe bleeding. These things can cause your kidney to shut down abruptly. In those situations, usually with appropriate management, about more than 90% of them will recover. And this tends to happen in people who are very sick in the hospital for one or two reasons. And then we have the chronic. The chronic, as the word suggests, is a slow process. So it goes on slowly for over a long time. And then by the time you realize you find it's too late. And that one usually is difficult to reverse it. So it goes on for a long time. Usually something happens, like an underlying condition that will affect the kidney, and then the kidney function will go down slowly over time until it gets to a stage where it starts manifesting symptoms. And usually by that time, the kidneys are shrinking, they are so small. In this case, you cannot reverse it. Then you have to rely on getting dialysis or kidney transplant. For the chronic, that is what is a big problem on us now, because once it happens, you can't reverse it. Then the person has to resort to going for dialysis or kidney transplant. Now, when it comes to the causes of chronic kidney disease, so subsequent discussions we'll be having, I'll be focusing more on chronic kidney disease. We have a number of causes that we have identified that is causing a lot of kidney disease in Ghana, in Africa. The first one is hypertension, high blood pressure. So if you go to the hospital, usually they put a cuff on your hands and then they check your blood pressure. if the blood pressure is high in this case, if it's persistently more than 140 for the top reading, and the down one is more than 90. If it's persistently high for a long time, it can damage the kidneys. The sad thing about it is that high blood pressure, majority of the time, you will not have any symptoms. Occasionally, you may have a little headache, but majority of the time, you will not have any symptoms. So most people have high blood pressure without knowing that they have high blood pressure. And these days, it occurs in young people. So you don't need to be 50 years or 60 years or 70 years to have high blood pressure. And we all know the reasons. Our lifestyles have changed. We are taking in more salt, we are eating more, we don't exercise much. So high blood pressure has become very common. People in their 20s, 30s, 40s have high blood pressure. And studies that have been done in Ghana shows that about 30 to 40% of people above 20 years have high blood pressure without knowing it. So when it goes on undetected, then it may end up in kidney failure. That's a chronic kidney disease. And the other thing is diabetes. That's high blood sugar. Diabetes is becoming more common as it was as compared to several years ago. And it's part of it is the same reasons, our lifestyle. So high blood sugar has been, or diabetes has been known to be the leading cause of kidney disease in the whole world. In Ghana, it's more of hypertension, followed by diabetes. And then we have other conditions, we call it autoimmune disease, an immune system problem that can also cause kidney failure. The common one, we call it lupus nephritis. And in this case, the person may have other symptoms, like joint pain, skin rashes, which may sometimes bring them to attention. And usually we are able to treat most of these. Diabetes also is also silent, just like hypertension. And you may have it for several years before you'll be able to detect it. And then other things that can cause kidney disease is kidney stones. One of the main things to prevent kidney stones is to drink a lot of water. The other thing that can cause kidney disease is prostate problems. And then if your prostate is enlarged, as for men, women don't have prostate, men have prostate. As you cross 50 years, 60 years, your prostate can get big, it can block the urine flow, and then it can cause kidney problems. And the other thing is people who use a lot of painkillers, like brufen, diclofenac. If you use a lot of painkillers, Gebedor, you are having body pains every time you are taking painkillers every week. Instead of going to check what is going on, you're just abusing painkillers. Over a long time, that can also cause kidney problem. So these are some of the common causes of kidney problem that I can talk about. And since your focus groups so young people, high blood pressure also in pregnancy have also been associated with a lot of kidney problems. So when the women get pregnant, some can develop high blood pressure. If it happens after delivery, you need to go for a checkup to make sure that that blood pressure, if it's still there, is treated and make sure that it doesn't progress to kidney failure.
Okay. Thank you, doctor. I think from what you have said, there's two key points, more than 2 points that stood out is there is increasing hypertension among young people.
Exactly.
And in a lot of the cases, we are not even aware because we are not checking. And then the same for diabetes and kidney stones, which we can really deal with through drinking a lot of water and staying hydrated. So this is a tip for us that we should try and stay hydrated, as it's good not just to quench our thirst, but also from a health point of view, that's very good for us. All right, so Doc, can you tell us about the symptoms of kidney disease?
Okay. So as I said earlier, I'll be dwelling more of chronic kidney disease. And chronic kidney disease, just like hypertension and diabetes, is also in the initial stages is silent. Chronic kidney disease has 5 stages or 5 classes. It has class 1, class 2, class 2, 3, 4, and then 5. The higher you go up the class, the more severe the kidney disease is. In the earlier stages from like class 1 to like class 3, you may not feel anything at all. That's how dangerous chronic kidney disease is. You may not have any symptoms at all. So if you don't check on your own, you may be having chronic kidney disease and you may not know. Most people may find it or they start feeling something when it has gone into the late stages, stage 4 and then stage 5. And at that time, usually we can't do much to stop the process. Maybe we'll just control the symptoms and the blood pressure and all that. But once you cross into those stages, that means it will still run its course. It will go on to stage 5. And when you go to stage 5, that's when you may start feeling symptoms like leg swelling, or your face may get swollen, or your urine, when you pass urine, you may notice that it's foaming a lot, like there's some soapy water in it. And then you may get tired when you walk for a short distance. You may have difficulty breathing when you go to bed, or sometimes when you walk, you may have difficulty breathing. Because the blood levels are low, I mentioned earlier that the kidney also helps the body to produce blood. So when your kidney fails, the blood levels go slow, and when you walk, you get tired. Sometimes some people may start having vomiting when they eat. They may have some stomach pain and all that. But I will emphasize that these things come in very late. So if you want to know that you have kidney disease, then you have to check. You will not have any symptoms until it's very late. And in that stages, stage 4 and stage 5, it's usually advanced. And at that point, you may not be able to reverse the damage that has been done. And then you may end up going for dialysis or transplant. And the chronic kidney disease has increased. We have it happening more frequently now as compared to, let's say, 20, 30 years ago. And it's becoming more like, maybe in the layman's time, like an epidemic on our hands. So we need to be checking ourselves, which is the point I want to highlight. The fact that you are walking up and down and going and not feeling anything doesn't mean that everything is well. If you check and everything is well, that's good news. You keep taking good care of yourself. But if you haven't checked, you can't say that, me, I'm okay. Somebody can say that, oh, me, for the past 10 years, I haven't had any headache for me to go to the hospital. The absence of disease symptoms does not mean that you are healthy.
Okay, thank you very much. So, again, let's not dismiss things because we are not seeing any signs. The signs only show up in the late stages. So we should be proactive and then test. So thank you very much, Doc, for emphasizing that. And as I mentioned, we are fortunate to have a survivor amongst us. And so at this point, I would just want to also ask our survivor, Brother Vincent, to tell us about, what made you, tell us about the process for you, about what made you go into the hospital the first time, your diagnosis process, what tests, what symptoms you spoke to the doctor about, and then up to the point that you were diagnosed with kidney disease.
Thank you, my brother. To start, about 4 years ago, It was a Lent time. I fasted for the 40 days. The last day, I did not eat on time. So around 10 o'clock in the evening, I bought something in the roadside and ate. And that night, I ran throughout the night. The next morning, I have seen a lot of change in my body. My legs have swallowed. And me, I thought the food I took, there's maybe a slow poison or something like that. So I didn't take it serious. A week time, the thing is not going, so I have to report myself to the hospital. Then I got to know that my kidney have a problem. And according to them, as I ran throughout the night, that's what is causing the thing. But what exactly happened, they are not telling me. And at long last, they took some of my tissue, that is, the kidney part. They said they are going to do a research in outside before they will give me exactly what's happened. That is my issue at the moment.
Thank you. So did you maybe follow up, ask more questions around what they found?
As times goes on, they call me to come for a review. As the last 2 months I was there for a review. So at this moment, they say everything is normal. Yeah.
Thank you. So again, how did you feel the first time when you were told you have kidney disease?
I didn't feel any bad, like something is going to happen to me, because I know what is causing that. I don't know where it's coming from, because since my lifetime, and I normally go to check up and do all things. No any results show that I have such a disease or such a kidney failure. But at that moment, they said that I just realized that no, nothing will happen to me. Yeah.
Thank you. Doc, so I think, again, we'll just transition to the part where we can talk about if one has been diagnosed with kidney disease, what is the treatment process, what kind of treatments, and then the adjustments that the person will have to go through.
So just a little comment on our brother's experience. So in his case, it sounds more like an acute kidney injury or acute kidney failure. And as I mentioned, you can have some severe illness, like diarrhea. If you have severe diarrhea, you run several times, and you're not replenishing the fluid that is being lost from the body, or you are bleeding. Maybe you have some injury, or if a woman has delivered, those kind of loss of fluid from the body in a very fast manner can cause the kidneys to shut down. So that could have been an acute kidney injury, and thankfully it's been treated and it's resolved. So with those ones, you can get it treated and it can resolve. But the ones that usually is challenging is the chronic kidney disease. So the chronic kidney disease, usually when it's diagnosed, we try to find what is causing this kidney disease. Is it the high blood pressure? Is it diabetes? Is it an autoimmune disease? And then we administer the treatment for the underlying cause of it. And depending on the stage, whether it's stage 2, stage 3, we give certain medications to try and prevent the kidney from going down to stage 5. So there are medications available that we can use. But it's best if it's detected early. If it's detected late, like stage 4, stage 5, then you can't do much, as I said earlier. So there are medications available for treating the early stages of chronic kidney disease. For those that come in late, let's say stage 5 or stage 4, then you have to prepare these ones for you will still need to treat the underlying cause, the hypertension, the diabetes, and any other thing that's identified. But if they go on to stage 5, then you have to prepare them for either dialysis or kidney transplant. The dialysis is a machine. What it does is that your kidney is supposed to remove waste from the body. So the dialysis does that, to remove the waste from the body. Water that has accumulated in the body, that's making the body swell up, the machine will also do that. It's not going to make the kidney go back. It's only standing in, week out. So when you start dialysis, you're actually going to be going on the machine 3 times a week. So maybe you go on Monday, you spend about 4 hours on the machine. You go in on Wednesday, you spend another 4 hours. Maybe Friday or Saturday, you go for another 4 hours.
I'm sure that's not cheap.
Pardon?
I'm sure that is not very cheap.
That's not very cheap. The stress that's involved is a lot. The average price per session is about 500 cedis. So in a week, you're looking at about 500 times 3. That's about 1,500 cedis in a week. And that's not all. You buy certain medications, transportation in and out of the hospital, the time you spend, and all that. So it's quite expensive to go through dialysis treatment. So we are stressing that we should check ourselves. Check your blood pressure. Check your kidney function. Make sure your blood sugar is okay. If there's anything that is hidden, we can pick it up early and then treat it so that we don't end up going through dialysis. The other treatment, which is the kidney transplant, is what we do is that we take one kidney from someone and then give it to you. But we go through a lot of tests to make sure that that person doesn't have any problem. It can be done. There are some people who are born with just one kidney and they can survive on one kidney for the rest of their life. Some may not even get to know that they have only one kidney. Amongst us here, about let's say about 1 out of 10 may have just one kidney, but you may not know.
So we must all check.
But God, in His own wisdom, you can survive on one kidney. So through that wisdom, that we are also able to take one kidney from someone that we have checked thoroughly to be sure that the person does not stand any risk in future. Maybe your brother or sister or mother or father or cousin or nephew. If the person matches you and we've checked everything, before we do that, the person can donate one kidney and then we can transplant for the person whose kidneys are failing. And then by so doing, the person doesn't need to be on dialysis. They now have a normal kidney function. But even that comes at a cost. The cost will not be, it's not cheap. You are looking at over 200,000 Ghana cedis for the surgery alone. And thereafter, you have to be on medications to protect this new kidney that has been given to you. And that also comes at an extra cost of about 3,000 cedis minimum a month. And that new kidney will not stay forever. Maximum 15 years, that kidney will also fail. Because your body will be fighting against that kidney because it's not part of its body. We call it rejection. Gradually, the body will try to fight that kidney. So about 70% of patients, by 15 years, they'll be back on dialysis.
So, Doc, I think you did mention from the beginning that we have 2 kidneys.
Yes.
But then now you are saying that there can be kidney transplants and you can get one. So, again, from the point of somebody who doesn't know, can you then say that it's possible you can go and mess up one of your kidneys knowing that you have 2 and then you have like a spare one, or that there's one is gone, the other is also gone.
Yes. So if you have kidney failure, it means both kidneys are gone. If one kidney is damaged and the other kidney is intact, you will not have kidney failure. So most of the diseases that cause kidney failure usually affect both kidneys at the same time. So high blood pressure will affect both kidneys. Diabetes will affect both kidneys. Usually those diseases like kidney stones may affect maybe only one side, may block urine flow on one side, maybe spare the other one. In that case, you may be able to treat the one which is affected. It may recover some function, and maybe the other side may be okay. But for them to tell you, before your kidneys function starts going down, means both kidneys are in trouble.
In my case, they say one is failing. In my case, that's what they told me. That means the one is working normal, but the one is failing. That's what they told me at the hospital. Yeah.
Yeah. Okay, that's good. So again, then we'll come back to you. Once you had kidney, one of your kidneys is failing. How did that affect your lifestyle? What did you have to change? What are the new adjustments? Because like you mentioned, it's been 4 years. So how has your life changed before you were diagnosed up to and now that you had that condition?
I have changed a lot of things in my life. As doctors say, a lot of money have gone in there before I'll be able to survive. Yeah, so it has changed a lot of things. It pulled me back totally.
Yes.
Yeah.
So definitely, as Doc mentioned, that treatment is not cheap.
Yeah.
And again, on your personal, you and the way you live, maybe some of the things that you were doing in terms of, I want like your lifestyles, maybe things you were eating now you can't eat anymore, things you could do now you can't do anymore.
According to the hospital, they give me a list of things that I need to eat and a list of things that I don't need to eat.
Tell us about some of them.
I can't tell you all, but some of them like salt.
Okay.
I have to limit my salt taking, and then I have to eat a lot of vegetables food. Yeah. Meat is not good for me. Yeah, they say all this.
Thank you for sharing this. So, Doc, coming back to once someone has been diagnosed, around the treatment and all, what are some of the lifestyle changes that person would have to live with permanently?
Okay, so the lifestyle changes depends on the stage of the kidney disease, but generally, for those that are in the early stages, we encourage them to have a healthy diet, as he mentioned, a lot more vegetables, less amount of salt. The salt we eat in Ghana is a lot. We have the Kobe, momone, sausages, kako, they are all loaded with salt. And salt is not good for the body. It causes hypertension. It causes heart problems. Sometimes they will bring, the wife or whoever has cooked for them will bring him the soup. Then he will take extra salt and then put it in the soup. And most of the food vendors were on the roadside, restaurants, KFC, the amount of salt in the food is terrible. But you know me here, Denintino. And one and DBT. High blood pressure. So we have to make conscious effort to limit our salt intake. That one is not for only kidney patients. It's for everyone. There's some communities in Brazil where they don't eat salt. And there's no single case of high blood pressure or heart problem in that community to date. The food, the yam that you are boiling, the plantain, the cassava, it has salt in it already. But because we want it to taste good, we add extra salt to it. And that's what's causing a lot of problems for us. So salt intake, it has to reduce drastically, whether you have kidney disease or not. That was a general advice for everyone. For those whose disease is advanced, usually they will tell them certain foods that contain a lot of something we call potassium. So they will tell them to reduce intake of food that contain potassium, like banana, avocado, some mangoes, pawpaw, beans. But this one is for those who are more or less like stage 5. But for us who are normal kidney function, you can still have those foods. We may tell them to reduce their water intake. For normal people, we actually advise you to rather increase your water intake. So they go to a lot of changes in their diet, which for us, you're a normal person, you're allowed to drink more water. But if you are in stage 5 chronic kidney disease, we may tell you to just take maybe the medium vortic the whole day. Because if you drink too much, you will get swollen. You swell up.
All right, okay, thank you. So I think it's worth noting again that salt is not really our friend. So for us, whatever we feel like adding more salt to it, we are actually putting pressure on our kidneys. So I think these are some of the steps we can also take to prevent kidney disease and also manage it. And then, Doc, there is a question. You know, there are some certain things that, you know, we want to know how they affect the kidney and the role they play in development of kidney. And one of them is aphrodisiacs, which, you know, there is the usage is on the rise among men, alcohol, and then herbal medicine. You know, we always say this one, it is natural, it is organic, it's coming from God himself. And then also excessive sex. So can you please comment around these 4 things for us?
Okay. So before, I'm not sure whether you talk about the preventive measures. We'll come to that later.
Yes, I think
okay, all right. So aphrodisiacs, majority on the market are based on herbal plants or herbal medications, and they are mostly mixed up with alcohol. Herbal medications have side effects. Whether you accept it or not, they do. 60% of hospital medications were discovered from plants, and they have herbal side effects. So herbal medications have side effects. We see it all the time in the hospital. They affect the kidneys, they affect the liver. Somebody will take herbal medication, and then he will develop, the urine will become dark, they become jaundice, they develop liver failure, kidney failure, or skin rashes. The fact that they are plants doesn't mean that they don't have side effects. They can have side effects because plants are made up of chemical components. Okay? And we've noticed certain people get exposed to herbal medications and they develop kidney failure, like in his case, acute kidney failure. Some too may be on hospital medications, then they stop and go and take herbal medications. And then all of a sudden their kidney function start dropping very fast. Maybe 10 people may take it, only 1 out of them may experience that. And it's like that with medications. So many people take it, they don't have any problem, but a few people may develop the side effects. It may be because of their genes or maybe the amount they are taking and all these things. And we all know that some of these herbal medications, we don't even know the right amount of doses that's supposed to be given and all that. They are not studied in human populations for a long time before we declare them as safe. Even though we have a scientific center for plant medicine, most of their studies are toxicologies or side effects are done in animals. They are not done in human beings. So how do we declare them that they don't cause any side effects? So they do. And alcohol can indirectly lead to kidney disease because alcohol intake can cause diabetes, can destroy the gland called pancreas, which helps to control our blood sugar. So if you take a lot of alcohol, it destroys your pancreas, you can get diabetes. And diabetes can cause kidney failure. Alcohol can also equally cause liver failure, and liver failure can also lead to kidney failure. So we should be careful with some of these things. It seems now it's like everywhere on the radio, on the TV, for some weird reason, every Ghanaian man is supposed to be impotent or not doing well enough. So now people are being cheered on to do more. I don't know why, but we need to be careful. We can be taking things in quote to try to do more, and at the end of the day, we'll lose our kidneys. And once you lose your kidney, the thing that you want to do more, you can't do it. You don't even have the energy to even walk around, let alone to go and do more of what they say you should do. So we should be careful about these things.
And then I think one of the things was excessive sex. I hear that is also very one of the factors. So is that true or?
Not necessarily. How would somebody have a sex test if they're not taking aphrodisiacs?
Okay.
So naturally, if you have a sexual activity, your body has a way of getting your body into a relaxed mode. Call it a refractory period. That will get the body to rest. There's a period where if you're not using anything to more or less increase your sexual activity, if you go 1, 2, 3, the body will go into a refractory mode to rest the body. So if somebody is having a sex, that means they are using something. And that something is the one that probably can cause the kidney problem.
Right, okay. Thank you. I think I just have a story about someone who was coming to the hospital for one particular condition. And the person was told that, no, forget about these hospital people. They don't know what they are talking about. Then they are taking the person to some herbal medicine practitioners. And the person got a lot of medication. 6 months later, we were in the same unit, and the person came back with kidney failure and then also liver cirrhosis. So I think it's very important for us to be mindful of how much with our dependence on herbal medicine. Because, the usage is on the rise everywhere on our TVs and everything. We do have that. So I think I would use this to also switch into perhaps even counseling and then, awareness. So my question is, what form of counseling do you give to patients? And then also for us, like having this gathering, how is there any awareness, activities going on to, bring up kidney disease into the place and spotlight that it deserves?
Okay. All right. So before coming to your question, there's always one question I ask people who listen to people's recommendations. If you have a car and your car is broken down, certainly you won't take the car to a teacher to fix it. You take the car to a mechanic to fix it. So if somebody tells you, oh, don't mind these people, go here, who is that person telling you that? What is his level of expertise and knowledge in that area? So people go around making recommendations anyhow, and people just listen to them, but we have to be careful about that. With awareness, I think there's ongoing awareness, but I think we need to do more. The Ghana Kidney Association, usually during the World Kidney Day, which we had it in March, we do a nationwide media engagement on various platforms, social media, the traditional media, and all that. But I'm happy your church has so decided to take this up and giving me this opportunity and Mr. Vincent to talk about it. So we should also carry this information out. Sometimes we think that the kidney disease is far from us, but if we know a friend or a family member or someone who has been through it, you appreciate that it's a big issue. And once a family member has it, it's a big financial burden on the family. So we need to tell our friends, tell our community members that we need to be careful about our health, check our blood pressures, avoid all these injections to prevent kidney diseases.
So, Brother Vincent, I think we'll come back to you again. I am interested in finding out whether when during your diagnosis, if people, what did they tell you from the hospital in terms of what level of education did they give you around kidney disease, and then also what people were saying. Did you at any point in time have people telling you, forget these people and go and try herbal medicine, or what's your experience around that?
No, at this point, no one tells me anything about I should forget about these people. I report myself to the hospital, and then they go ahead and do whatever they need to do, because I'll be going to check up all the time. I never had that experience before, but as I report myself to the hospital concerning that, even before I report myself to the hospital, I don't know whether I have a kidney failure. When I report myself, before they told me this is the issue. So now, what is causing it, that's what I don't know, because they took some of my tissue that they are going to do research and get back to me. Up to now, they didn't get back to me. Only say I'll be going for review. They'll call me for review, so that's what I'm doing now. But at the review, the results, they say things are normal now. Yeah.
So that's very good to hear. So at least we can say from our brother's experience that if you allow yourself to go through the process, if you follow your treatment regime, if you follow instructions carefully and strictly, you are likely to get a very good result. Right. Oh, Doc. Yes. Okay.
Yeah, so in his case, he went early, it was detected early, and he followed the treatment. The tissue they took, that's a kidney biopsy, to see what was going on, and he has recovered. So if people present early, we'll be able to intervene and stop the process from progressing. Yeah.
Okay, so I think in your last submission, Doc, you talked about the Ghana Kidney Association. Can you maybe talk about some of their activities and also the government, what role the government is playing, regarding kidney disease? How resourced are we in the country and all that?
Okay, so Ghana Kidney Association is made up of doctors, nurses, and other healthcare practitioners that are involved in the management of kidney conditions. We've been involved in a lot of media activities in terms of promoting the education and also promoting training of doctors and nurses. We don't have enough kidney specialists in the country to take care of the number of cases that we are seeing now. So that's one of the main objectives, to push for more doctors and nurses to be trained in kidney disease. Apart from that, also advocating for the government to take up the cost of treatment for kidney patients who are on dialysis. So far, we've not been successful. Dialysis facilities in the country, in Accra, we have a lot of private facilities and then a number of government facilities that provide dialysis, but not all the regions in Ghana have dialysis facilities. And some regions have just only in the district, the regional hospital. So if you have to travel long distances, maybe 3 times a week to go for dialysis, is a lot of stress. Like, let's just say, for instance, Eastern region has, only the regional hospital has dialysis services. So if you are in Nkoko or Kwau and you have kidney failure, you have to travel 3 times a week to that place for that. That's a lot of cost and expense. And in Ghana, still patients are paying out of pocket. We don't have any legislation or funding to support dialysis patients, which last year when we had our 50-year celebration of dialysis, we sent a proposal to the government, and this has been done over the past years, but we are still pushing for the government to try and pay for dialysis treatment for patients who have kidney failure, and also to push to get kidney transplant being done more often in Ghana.
Yeah, so I think it would be very good if we can have the government, stepping in more and then support.
Exactly.
As our brother mentioned,
exactly.
The financial burden was enormous. And the effect that he still continues to live with. So, again, there is also to Brother Vincent. There is in some conditions, you do have a lot of patients that you can engage with, that they would encourage you to, keep up the spirit, do the things that you have to do to ensure that you would survive. Did you have any experience with other kidney patients or survivors who?
No, I didn't have any experience with any such people. Yeah, as I was there, only family members visited me and encouraged me that everything will be okay. Yeah.
All right. Thank you. So, Doc, with the survivors, so is there an association like that usually one can join? Because sometimes, I know from experience, you have people who are usually reluctant to follow through with their treatments and the processes, but once they are in a group of people who are encouraging each other and supporting, they tend to follow through with their treatment course. Is there an association or a group like that?
There is, but I think it's largely limited to patients in Accra.
Right.
I'm not sure if the other regions do have patient association, but I think in Accra there's a very good association that most of the patients are part of.
Okay, all right. So I think at this point we would like to open it up for our audience to ask their questions, comments, contributions, and so the floor is open now. Any questions? Yes. And the questions can be addressed to our resource persons, either one of them, our survivor or the specialist.
Yeah.
Fellowship.
Please, my first question is, you said intake of salt, but we realize that there are some people who says they have low blood pressure, and for that matter, they take more salt. What do you advise? Is it correct that if you have a low blood pressure, your intake of salt should go high? Then number two, if your one kidney is donated to another person who is suffering from kidney issue, and that kidney is going to last for 15 years, you donated one, how long is your kidney going to survive? Thank you.
I think that's a very good point. Yes, I think we'll take.
Okay.
Yes, okay.
Right, thank you. Mine is gotten to do with the hypertensive people. In this case, if you are being diagnosed of being hypertensive and you've been on the rule of taking these lisinoprils and things for a longer period of time, will it in any form affect your kidney? Because that's some rumor I heard. And aside it, are there any foreign medicines that when you take over time, it can destroy your kidney?
Any what?
Foreign medications that when you take over time, that can affect your kidneys. That's what I would like to know.
Okay, so with the low blood pressure they say is in what we call a normal distribution. It's not, some people are on the low end, some people are on the high end, some people are in the middle. If your blood pressure, the low blood pressure is not giving you any symptoms like you are feeling dizzy or collapsing, if the blood pressure is low enough to make you feel dizzy and be collapsing, that means there's something else which is making it low, and it needs to be investigated and treated. Some people may have normal blood pressure of 80/40. They don't have any symptoms. They don't need to take in any more salt. If they are getting low BPs and they are collapsing and fainting, it's a disease that needs to be investigated and treated. The solution is not taking more salt. Okay. With someone who has donated their kidney, before we allow you to donate, you do some series of tests that can make us predict how your kidney function will behave, all things being equal, up to about 80 years of age. And if it's below a certain cutoff point, if not above that cutoff point, we will not allow you to donate. So if you donate one kidney, it means that if you allow you to donate, that means that that kidney should be well functioning up to about 80 years. So that kidney should be able to take you to beyond 80 years. If the function is not good enough to take you beyond 80 years, we'll not let you donate. And hypertensive medications. Yes, that rumor has gone on around a lot that when you're on hypertensive medications for a long time, it can destroy your kidneys. That is not true. Most people, when they rather stop taking the medications, that is when they develop the kidney failure. Or they get stroke. Somebody can be on medication for 20 years. Oh, I'm tired, my breath. And the next 1 year or 2 years, they get a stroke or they get kidney failure. And they turn around and blame it on the medications. No. But there are certain medications that if you are on, you need to be seeing your doctor. Medications have side effects. You may not be able to appreciate the dynamics of certain medications. If you're taking any medication and you think that it's giving you a specific side effect or something that you're not happy with, talk to your doctor. He will adjust it for you. And for the men, most of the time, we complain that when we take the medications, we cannot perform the way we are supposed to perform.
Yes.
And only when you talk to your doctor, he can change it for you. And you'll be able to perform the way you're supposed to perform. So win-win situation, isn't it? All right. I mentioned certain medications like painkillers, brufen, diclofenac, Gebedor. If you took those medications very frequently for pain, and maybe because of the kind of work you do, or you have some back problem or something, if you take them very frequently, they can cause problem. It's not like one time, maybe you had some problem and they gave it to you for 5 days. That's okay. But if you're taking it week in, week out, you are taking it every time, it can cause a kidney problem.
Thank you very much for your presentation. So my question is with the topic, young but failing kidneys. So I'm trying to understand it that then there's a growing concern of a lot of young people contracting kidney diseases. Do you think that young people are really concerned about it? And I want to ask about the statistics because you've been in that space for long. What's the growing concern about young people contracting kidney diseases? And when should you be well aware of it that, okay, I'm at this age, I should go and check if I'm experiencing anything of, yeah.
Okay, so when you compare the information we have about kidney disease in Ghana and then sub-Saharan Africa, majority, about 70% of people with chronic kidney disease are between 20 and 50 years. These are young people, working population. In the developed countries, majority, 70%, are above 60 years. Okay, there are some issues with genetics, and also there are also suspicions that the environment is contributing to it, the change in lifestyle, and also certain things that we are taking. There's still a lot of studies ongoing to find out why it's occurring more in young people, but some of the suspicions are surrounding the environment and what we are taking in and the changes in lifestyle, which is bringing hypertension to very young age groups And then these hypertensions go on undiagnosed and then causing kidney failure. So if you are 20 years, you shouldn't wait until you start having symptoms. You should check every year. Check your blood pressure. Check your blood sugar. Check your kidney function, cholesterol, and make sure that these things are okay. Because not all these things are abnormal, then they can cause a kidney problem. If we find out that your blood pressure is high or your kidney is a problem, then we investigate and get to the bottom of it and treat it. Than to wait until you see your leg getting swollen or your face getting swollen or you're getting tired. At that point, maybe too late to intervene. So we want to carry this information across. Most of us young people, we are not conscious about our health. But if you have, let's say, a car, almost every 6 months you take that car for servicing. Right? People who have cars here, you do that. At least every 6 months or once in a year, you take your car for servicing. So make it up your mind that if you don't have a car, the only car you have is your legs, isn't it? The body that God has given to you, take it also for examination at least once a year to make sure that nothing is hidden that will come back to haunt you in future.
Please, I want to ask a question. Is it alcohol good for the body?
Is alcohol
Good for the body?
Alcohol is not good for the body. If it's taken in excess amount, usually we call it, say we use a certain figure called 14 units. The 14 units may be equivalent to about 4 bottles of beer in a week. If you take more than that, you stand a chance of getting problems from alcohol, which can include diabetes, liver failure, and also heart failure.
Okay, I want to ask this question. Is it HIV and kidney? Which of them are dangerous?
HIV and what?
Kidney, which of them are dangerous?
I think, every disease is very dangerous, so I don't think we should be very selective in which one we want to choose. But do you have any specific question around kidney disease? But yeah, please, every disease is dangerous, so don't we shouldn't have choices. Please. Malaria, equally.
I think he wants to know if one of them is basically more dangerous. But I love the way you said any of them, yes. Whether kidney, whether HIV, they can take you to your grave. So all is equal. My question I would like to ask is that, normally they say if someone smoke and you are, beside that person, you are near to that person, you are rather harmed than the one smoking. So my question is, if you inhale someone smoke or pollution, let's say, pollution.
The slimming aspect will not happen. Okay. You just have to watch your diet and exercise.
Okay, so what do you think about weight gain syrups too? So there's quite a lot of substance on the market that when you consume, it kind of makes you gain weight. What do you think about that one too? Does it affect the kidney in any way? Exactly.
So weight gain can affect your kidney. If your weight is very high, BMI, if your BMI is more than 40, it can actually directly cause kidney problem. And weight gain can also increase your risk of getting hypertension and diabetes. So if your weight is high, you should aim at trying to lose weight so that it reduces your risk of kidney disease and also hypertension and diabetes that can cause kidney disease.
So the question is, she wants to find out if a person can be born with just one kidney.
Yes. Nti yɛwɔ nkurɔfoɔ bi a wɔn yɛbɛbɔ wɔn na wɔn kidney no nyame kyekyɛ no wɔn duro na aka baako pɛ. But they can still survive with it for life. Yeah.
Sir, please, they said, but he said smoking is no good. But some says that smoking helps to release stress from your body.
There are so many things you can do to relieve stress that will not cause kidney problem, that will not cause cancer, that will not cause so many issues in the body. So you can do other things. I think there are some there. You can relax, you can keep calm, you can take a rest, go for a fun activity in a group. Even coming here for this service can help you to relax rather than smoking. Okay?
And you have a lot of options of things to do up on the screen right now. So look at that too.
Thank you very much. I wanted to find out this lifestyle of some people who tend to withhold a lot urine in them for a long time. What's the linkage between that lifestyle and the kidney problem? Thank you.
Okay, it's not a good thing to do because when you hold your urine for a long time, bacteria can grow in the urine and then cause an infection. And if you keep getting repeated infections, frequent infections, urinary tract infections, it can affect your kidneys. Okay? So, as soon as possible or practicable, if you feel the urge to pass urine, try and get it done.
Yeah, thank you very much. And there's this thing that we have to take in plenty water, like 7 glasses a day. So some of us will drink a lot and it makes us urinate plenty. But recently, another person came out that when you drink plenty water like that, you make the kidney overwork and it weakens the kidney. How true is it? Is it good to drink plenty water and urinate more, or it is bad to drink plenty water? Thank you.
So, plenty water means that minimum of 2 liters and a maximum of 3 liters in 24 hours. In our environment, it's very hot. So, I would say between around 2.5 liters. That's about 7 glasses of water in a day. Or if you want to use sachet water, 2.5 liters will be about 5 pieces of sachet a day. Drinking enough water is important. It helps to prevent dehydration and hydrate the body. So taking in 2.5 liters, 3 liters of water a day is not going to cause any kidney problem. It's rather going to protect you against kidney problem, particularly kidney stones. People who have kidney disease, who have gone on to stage 5, doctors or their carers may tell them to reduce their water intake. Or people who have maybe heart failure, they are swollen, so the doctors may tell them to reduce their water intake. But for a normal person, we rather encourage you minimum 2 liters, maximum 3 liters a day.
Hello. Please, what are you people doing about the dialysis, the charge? Which people are dying more because of the charge? Maybe they can't come to the hospital. So what are you people doing? You, the doctors, and the government should collaborate so that you make one. And it can be done. But I don't see the reason why you people cannot do it up to now.
So we've been, I might say that as Ghana Kidney Association, even as far back as 2004, we've been chasing the government to try and put it at least, if not anything at all, one session on national health insurance. But we've met a lot of fierce resistance from the government. So, but we have not given up. We will still keep pushing until we get through to get a favorable response. And I agree with you, it's sad, it's unacceptable that as a country we cannot provide social protection for certain medical conditions for people. But we won't give up, we'll keep pushing. Somewhere last year, we had our 50 years of dialysis in Ghana. One of the main agendas was to push to get it. We still haven't gotten a favorable response, but we won't give up.
Please, I want to find out. You see that we have the hot weather nowadays. So if I take chilled water, that you can see that the water is just sweating from the fridge, crumple. If I take, does it have effect on my kidney?
No, it doesn't. It doesn't have any effect on your kidneys.
Okay, last question. Last question. Thank you very much. Doc, I learned that these spices we used to cook, various ones, I mean different types, it's killing people. It's killing people. I want to know what you are doing, the doctors and then these associations, what are you doing about it so that,
Sorry, I didn't get the first part of your question.
I mean spices that we put in our food. It's killing us. So I want to know what doctors and then other associations are doing about it so that these dying things can come down. I mean the spices.
Okay, so what we can do is to keep educating us. Some of the spices have extra salt in them to cut down on the salt that you are using. In any case, before these spices came, our mothers were still using the natural spices. The ginger, the garlic, and all that. So we can still keep to our natural spices and then avoid all these other spices that they've put in so much salt in it. So that's what we keep educating. These things have been approved by the FDA anyway, so you can't stop them from selling them. But we should arm ourselves with knowledge that we'll cut down on these spices and rather resort to our natural spices.
Okay, thank you very much, Doctor. And thank you very much to our audience too for all your questions. I think at this point we would like to bring down this discussion. And before we go away, I would like to ask our brother Vincent to, do you have any advice for any of us, based on your experience, based on just the whole process for you? What advice do you have to all of us?
My advice is, as the doctor said, we should keep on checking our bodies. So far as you have a car, if you don't take the car to the mechanic shop, the car will break down. So we should go on checking on our bodies at least once in a year. Is cool. Thank you.
Thank you. And Doctor, also, do you have your final words to all of us before we depart? I know you have spoken a lot about some of the causes being high blood pressure, which is on the rise among young people, diabetes, kidney stones, and even abuse of painkillers. Along all those things, can you summarize and then your final words and advice?
Okay. So I'll still go back to what I've always been passionate about, that we should check ourselves. At least every year, check your kidney function, check your blood sugar, check your cholesterol, and then also make sure that if you have any of these conditions, you see a doctor to manage it for you properly. If you're not happy with any of the medications, talk to your doctor. There are always a number of medications that can be used that will suit you. And then our diet, we need to cut down on salt intake. We need to cut down also on refined foods and resort to eating food from nature. That's what God told Adam and Eve in the Garden of Eden, that they should eat from the fruits of the land, of the vegetables and all that. So we should include vegetables and the fruits in our diet instead of going for the soft drinks and the pastries. These ones are not good for our health. Cut down on our sources of sugar intake. Now these days, if you go through town, you see so many shops which are opening. They are just stocking it with all sort of soft drinks. And they move very fast. You see so many cars, they come and offload. By the next 2 days, everything is empty. People are just consuming a lot of sugar, and this contributes to diabetes and hypertension. So you should cut down on these things. Eat natural foods, food that you can cook and boil, and cut down the salt intake. And then last but not least is exercise. Ordinary walking is a form of exercise. So we should make the point to walk. Our grandmothers, grandfathers walked. Now because of car, we don't walk. And we've all eaten so much and gained so much weight, and we are struggling with hypertension and diabetes. So let's walk. At least try and do about 5,000 steps every day. That will help to reduce the incidence of hypertension and then diabetes as well. Thank you very much.
Thank you very much, Doctor. And thank you very much, Vincent, for spending your time with us. Thank you very much for all of that.
Thank you, Doctor. Please, we invite Praise Dynamics to lead us in offering.
Hallelujah. Yebe ibudin. Maye. Yebe ibudin naye. Wedi kuni mama ye. Oh mama wokumno. Ofata se ojaye. Nyame kwama. Yebe yihudi naye. Oh yebe yihudi naye. Wedi kuni mama ye. Yebe yihudi naye. Wedi kuni
Amen.
We will call our brother Isaac Tete Ado to give us vote of thanks.
Naposo. Asa mo bi nyefa ne ejola anye. Eyaf. Nyefa ne wabango shida waha chofele. Ake eke mene gbine kiwo. Eba bo awona bi ne femfe o. Woni fi mo ete no jogba. Waka shida anyumo. Kuna gbene ho woda wa papa osofo ke session members finishing. Ake amenwogbe ni yaf. Mene gbine wono fi mo ebam. Waka session ke papa osofo nyera don. Ke ka gbene nte o women's solution. Ke men's solution. Mi na o mami me ko ba bi ke je je teni me ko me ba bi. Ame bi elolo ame wote am. Ame ke we ba fi o program me. Wonye me waka nyera don. Watch me home piano. Okay, watch me. Nyamunye radon. Kakagbene wana wielo wakenye radon. Kakagbene shindani nyese waken han yaf members. Kakagbene asafombi fe ni nye babi ene. Ni bekene woni fe mo efe jogwa. Wakenye radon. Ihi ape okomi nka afata ene achuko mi ake ma fe shima wi. Makpa fa ake. Nke we program neke fe mo. Me feel like none about fear ye bluffo me. She won't be more. Ekume by any neighbor gami. Ihe I can make me yes and be more come. Ni may be a bluffo me war. Inye neighbor be or makpafa ekoni. Keje baleneke. Obano we bluffo bone. She can gum by any flu. Obio sanya gami. Koni keje aleno moko na hoko ye bluffo me. Enye ni lehu. Ike gan ababi nyefa na nyera don
break na wuka se gangan wuka gan bebre na man tehwe de wuka na man te da wuka e mponti de na me di kofie patch announcement
ya fine jola hanye yaf you on your friend where I don't work over many program ne well a few announcements. What pay desk here outside need one register for kidney screening 40 cedis for each person. When you find a care you are interested, the care akpa obanyani Ocho bank many or Pono here, Buena, Coniwo register, Bonake, Wake, unless you test, you do not know. So we urge everyone to test so that we will know. And then to Friday, we are coming here again for our My Worship, Our Praise program with our brother Shadrach, Mensah. Everybody is invited. Nyefenye ha woba kuniwo be a program na ojugba. Saturday woba ya work. Tomoboni wo announce woba shi be at 5:30 a.m. Woba ja t-shirt as usual. Woba take wo normal route and we take over the years. Everybody is encouraged to participate. Okay, we need to exercise. So join us so that we'll exercise to the glory of God. Nyefenye iradon. Find out what I want you know Samo Odui, Koni Esole, Konwopa.
You find any was all here, yes, Shibami. If I know what that Christo Shinyake, Bekana Shine, if I were him. Ni bopeni se hie eha ni oba kase ni bonisa woti ameni wole gbekene eha ni wole no ni mi ni woyo wonya woda Kristo shi nya woda Kristo shi ifa anya wo solia wache ke wonu mo wonda bo shi baba obeke na shi ne ake efe odromo ke omo bonale na mene gbine hu ebani na wo ni bopeni sa oha ni woba kanse yowa ehia ake wogbomechiwe ni okedro wo wole ni bi ni ya no yemlin beke na shine oba ha woni chomo yemlin wonda boshi baba o wonda boshi o mami me fe ni obi o papa me fe ni obi nye me fe ni obi yowa wonda boshi o wala hebon ake odro wo mene gbine ni wonye woba agbene obi ashimo ke wo we anya Kristo wamba ke ojale ni dewulue ni hie wo mi ke oba shebie ne ke ni dewulu ne no afata wo e hie wo mi tata ni ike wo ayashe wo we am hwehwehwe wota meni